So I'm making the third pack, bro.
That's okay, it's okay. Continue, bro.
Bro, I think you should control your cigarettes.
Oh man, you're already high. It's okay.
I know, man. Take. Yes.
Bro, can you just fill the coke for me?
What happened, bro?
I,
Are you okay?
I took.
What happened, bro? Wait. I call ambulance. Brother. Get up, brother. Help!
What happened? What happened?
We were just drinking and something.
See, he's drooling.
Yeah.
Can you try to take out your tongue once? Can you try to smile once? Try to raise your hands. Can you raise your hands? He's having a stroke. Call the ambulance.
I already called the ambulance. Just wait.
Okay,
It's coming.
let's wait. Stay calm.
So what is the issue with him?
Actually, he got an acute stroke.
Okay, so can I know the medical history?
Once he had cardiac arrest.
Okay, just once.
Yeah.
Is he on any medications right now?
No.
Okay. Can you raise both your arms up? You're not able to do it. Okay. Can you read what's written here? It's fine. Take him to the diagnostic center ASAP because we need to get the MRI done within 25 minutes. Make it fast. Okay. Now, what is stroke? Stroke is a sudden interruption in the blood supply to the brain. Now, most of the strokes are caused by an abrupt blockage in the arteries that leads to the brain. Now, because of this, the brain tissues do not get the sufficient amount of oxygen and nutrients that they require, and hence the brain cells die within minutes. Now, this is the most common type of stroke, and this is the ischemic stroke. The other strokes are caused by bleeding within the brain tissue, and this can be because of a rupture of any blood vessels. Now, this is the hemorrhagic stroke. The effects of a stroke depends on which part of the brain is affected and to what extent or how severely it is affected. Now, detecting the early symptoms of stroke is very crucial because a prompt treatment can reduce further brain damages and brain complications. Now, if any of us happen to a bystander, we can recognize the early symptoms of strokes by asking three simple questions. One is by asking the person to smile, and two, by asking the person to talk. Repeat a sentence and ask the person to tell it after you. And the next is asking the person to raise their arms. If the person has difficulties doing any of these or all of these, then it can indicate symptoms of stroke. But besides these, you can also ask the person to stick out their tongue. If the tongue is crooked or moves to the side, then it can also indicate the symptom of stroke.
Signs and symptoms of stroke. Acute change in the level of consciousness or confusion. Acute onset of weakness or paralysis of half or part of the body. Numbness of the half or part of the body. Partial vision loss. Double vision. Difficulty speaking or understanding speech. Difficulty with balance and vertigo.
Treatment of stroke. The treatment of stroke depends on the types of stroke. For ischemic stroke and transient ischemic attack, these types of stroke are caused by a blood clot or other blockage in the brain. For that reason, they are largely treated with similar technique, which include antiplatelet and anticoagulant. Anticoagulant and antiplatelets should be taken within 24 to 48 hours after stroke symptoms begins. And for mechanical thrombectomy, the surgery is most successful if it is performed 6 to 24 hours after the stroke begins. And hemorrhagic stroke. Stroke caused by bleeds or leaks in the brain require different treatment strategies. The treatment include medication, which can prescribe drugs that can reduce blood pressure, lower the pressure in the brain, prevent seizures, and prevent blood vessel constriction. Coiling. This blocks blood flow to area reducing bleeding.
Medication of stroke. Tissue plasminogen activator. It is the only stroke drug that actually break up blood clots. It is used as a common emergency treatment during stroke. Antiplatelet drugs. Those medication prevent blood clot by making it more difficult for the blood platelet to stick together. The most common antiplatelet drugs include aspirin, anticoagulants. These drugs reduce your blood ability to clot. The most common is warfarin.